Hello, and welcome to the Postpartum Years podcast. I am your host, Dr. Mary Ellen Kramp. I am a physical therapist and a pelvic health specialist. Joining me today is IBCLC, or Internationally Board Certified Lactation Consultant Extraordinaire, Catherine Halek. Today we are going to be discussing weaning. Kat, let's talk about weaning.
All right, let's do it. So everybody weans.
Yes.
At some point, right? Everybody weans. Like we don't continue to eat from our mother's chest until we die, right? So everybody's going to wean. Weaning at different points in time have their own nuances and tricks for being successful. But sometimes weaning is necessary for medical reasons. Sometimes people by choice want to wean. Our bodies are supposed to produce milk, and some people decide not to breastfeed, and that's their choice. And a part of their weaning journey is by not stimulating their breasts.
Yeah. So tell me how that goes. Somebody gives birth, they decide, I do not want to breastfeed. Yep. How does that whole thing play out?
Yep. So different people are going to experience it differently. Some women, just simply not having the baby latch or pumping will prevent their milk from coming in, and they don't have a lot of pain or discomfort or engorgement, and it just kind of just fizzles on its own, right? They don't need to do a whole lot. Other women, their body, regardless of how many times they stimulate their nipples or remove milk in those early days, it's going to kick into high gear by day 3 to day 5, and they're going to have the free boob job that nobody wanted. That's super painful. And those moms, we recommend ice. So breast fullness, engorgement, painful breasts, ice is what's recommended, anti-inflammatories, and wear a supportive but comfortable bra, like not a bra that's too tight or that has underwire that's poking into you.
Not binding.
We don't bind anymore. Binding actually can damage glandular tissue. And there have been women that have had such severe engorgement that chose not to breastfeed their first children, and they binded their breasts, and it damaged their glandular tissue so that they weren't able to produce milk for subsequent babies when they were older and wanted to, which is really sad.
Okay, so we've covered those that don't want to breastfeed at all.
Yes.
What about women who need to start weaning, say for medical issues, like long before they really want to wean?
Yeah.
So somebody who's like really in the throes of, the baby's 3 months old and it's the only food they're getting.
Yep.
But say they were diagnosed with cancer or something, and they do need to stop breastfeeding right away. How's that weaning process?
I first just want to make the caveat that in a lot of those cases where people are told medically that they do have to wean, they actually don't. And so really consulting a lactation consultant, going over like the medications that they're going to be taking, the pain meds, the contrast for the MRI, the surgical procedures, that whole process, like we don't necessarily have to wean oftentimes, and it's very frustrating to me that isn't well known. So first make sure that you need to wean. Or is there some other way that we could manage this if you want to continue? And mind you, all of this is the woman's choice. So it's like sometimes I will talk to families and they'll be like, yeah, I have to start this medication. And I'm like, oh, but that medication you don't have to wean. Like you could continue taking that medication and continue breastfeeding. And they're like, yeah, but I have to take this medication. And I was like, okay, you have to take this medication and you don't, like, cool, like, then let's stop. Do you know what I mean? Then you don't want to continue, and that's okay. And I wish that was normalized also, like to be honest and just be like, no, I just don't want to, that's a good reason to wean.
Yeah, because there are the times, because I remember with each of my 3 kids getting to the point where I feel like just a freaking cow. Like all I'm doing is producing milk. All I'm
Moo.
doing is feeding. And this is hard.
Yeah.
This is hard.
Yeah.
And I can easily see people just going, nope, done,
Yeah.
done.
Yeah. There's a difference between, so like, I feel like sometimes in life as parents, we choose hard. And when we choose hard, we struggle, but we don't suffer.
Hmm.
And then there's a difference between kind of feeling obligated to do hard, even though it's not what we want and it's not what we're choosing. And that is suffering.
Hmm.
When things are hard and you don't really want to be doing it, that's suffering. And I'm not here for suffering. I don't do martyrdom mommies, right? Um, Weaning, there's different types of weaning. So there's baby-led weaning, where the baby naturally just decides they don't want to breastfeed anymore. Okay. And anthropologically speaking, and historically, like from the dawn of time, that age is 3 to 7 years old. We're going to circle back to the surgery situation, but that's 3 to 7 years old is when babies just are like, yeah, I'm good. All right. Then there is mother-led weaning, where we decide that we are done and we choose to wean. And that can be whenever, and sometimes it is medically necessary. For situations where medically, like really, mom needs chemo and breastfeeding needs to stop, or mom's going to die,
Hmm.
that's a situation where, yes, weaning needs to happen. It needs to happen quickly. I do like an aggressive, like, step down plan. Again, we've been talking about milk supply. We've had if go and listen to our other ones about supply, because weaning is a part of this, but basically nipple stimulation, milk removal, frequency, right? That's what most people have that drives their milk supply. So when we're weaning, we do less nipple stimulation, less milk removal, less frequently. And I usually do like a more aggressive care plan to like try to dry up milk as much as possible within like 2 weeks when it's a medical situation,
Hmm.
or if it's a urgent situation for various and sundry other reasons, or by choice. Like, I've had families and dyads that have had repeated mastitis, and after their 4th one, they're like, I'm done. I need this over with now. And I'm like, okay, let's do our 2 week step down plan of like, taking things less frequently. I will say, unfortunately, when we're doing aggressive weaning, like quickly weaning, that I like people pumping rather than direct feeding, because it's easier to measure, quantify time, amount, progress when we're seeing it come out of the body, and we can measure it. And we can also like set a timer and etc.
Hmm.
When we're direct feeding the baby, that's like there's another person involved. You know what I mean? It's the two of you guys interacting together, and you may be like, okay, 5 minutes, you're done. And we also don't know what the progress is, but the baby might be like, no, I don't want 5 minutes. I want the 35 minutes that I've been doing, mom.
Hmm.
So oftentimes, if the family is open to it, I will switch them from direct feeding to pumping to make that weaning transition faster and easier. And then you just do less time pumping, less frequently, gradually over time. It's not that hard. You could technically, depending on your history and your amount of needing support, do that on your own without a lactation consultant. Because most of the time I'm like, you need a lactation consultant. But this one, if you switch the pumping and you're just like, okay, today I'm going to go from 8 pumps of 30 minutes or 20 minutes down to 8 pumps of 10 minutes, and then 7 pumps of 5 minutes. And you just kind of whittle your way down, or pump when your breasts feel uncomfortable. And hopefully that time gets in only for 5 minutes, and see how long it takes. Is very gradual, and it takes a lot of time for the milk to completely and totally dry up. But you can get to the point where you're comfortable not lactating. and able to do whatever medical thing, usually with an aggressive weaning plan in about 2 to 3 weeks.
Hmm.
So that's for an aggressive weaning plan, that's about the time frame.
That's pretty reasonable.
Yeah, it is.
One thing that we've seen with patients that we've had is the baby going on a breast milk strike.
Yes.
So explain the difference between strike versus weaning.
Weaning. So there's this magical time, and if you want to stop breastfeeding and you don't want to breastfeed a toddler, there's a magical time where they get mobile and they're very busy and they are significantly less interested in breastfeeding. That sometimes feels like babies are weaning and it's interpreted as such. And then the mom's like, oh, you don't want it anymore? Cool, we're not doing it anymore. And then they wean. And that happens between I usually see that between 10 months and a year. So that's kind of a natural developmental thing. And you don't need as much milk. So your milk supply does go down, but that's kind of that situation. A nursing strike is when the baby just stops going to the breast. And it's not, I wouldn't say that the baby's choosing it. There's usually a reason, there's usually something happening that's causing them to not want to go to the breast anymore. Oftentimes, it's an older baby that's teething that chomps down on the mom's breast. The mom has a big reaction. It freaks the baby out, and the baby thinks, oop, that's not safe anymore. Not going to do it anymore. Not going back to the breast. All right. Oftentimes, I would say there's a high incidence of those situations where baby's 9 to 10 months. That's usually when I see that biting thing happen to the point where they have such a strong reaction, and then the mom stops, and baby won't latch. And oftentimes there's also oral dysfunction involved. So like lip and tongue ties issues, or structural issues with like torticollis, sometimes like the plesiography, which is like misshapen heads,
Mm-hmm.
and torticollis is just like tight twisted neck. Sometimes that's a play, but most of the time it's an untreated, undiagnosed tongue tie that once the teeth come in, the baby can't adequately move its tongue over that bottom gum ridge, and they were just making do somehow. And then now there's teeth, and those teeth, the baby's not protecting it, because when babies teeth, they're supposed to have their tongue down and out over those gums so that they don't bite you and that the teeth doesn't hurt you, because you can breastfeed when babies have teeth. It's a thing. People do it. And I'm not one that would continue breastfeeding if it hurt, and I breastfed till 2, and so Jax had a full mouth of teeth, and it didn't hurt. So babies will, have their tongue down and out, and that latent, nobody caught that tongue tie before, or wasn't causing an issue before, it all of a sudden does because they cannot cover the bottom gum ridge. And then those teeth, and when teeth first cut, they're sharp. They are so sharp because they had to cut through gums, and they haven't rubbed up against something to get duller yet, And so they can feel like razor blades, and that can be very painful. And the baby will just chomp down. Mom will have a big reaction. Baby's like, nope, not going back to doing that. Also, I've seen stressors in family's life where mom is going through something. There's craziness happening in the household. Baby starts to, get more bottles. And then the baby's like, yeah, this breast thing, whatever. She's too, she doesn't have time for me kind of a thing. Like the baby, that's how I'm interpreting it, is that baby's feeling frustrated because mom, baby would rather just be in control itself than to be patient and wait for mom to sit down and actually be present for that feed. So I've seen that with household structures and stressors and moving, lots natural disasters,
Yeah.
hurricanes. We're from Florida. We've been living in Florida for a long time, and I've seen that happen around hurricanes and stuff like that, where there's just this high stress. And for some weird reason, the baby doesn't want to go to the breast anymore. And it's not the mom's choice, it's the baby's choice. And the baby's like, you're too too much right now. Um,
I did see one case that we had also shared
mhm,
where it was a youngest baby,
mhm,
older siblings, older cousins, older friends. They were all together at Universal Studios for several days. And this baby, who was probably about 9 months old at the time,
mhm.
is breastfeeding, but watching everybody else and going, nobody else is doing this. And boom, like just stopped breastfeeding, like would refuse to go back to the breast from that moment on.
Yeah.
And mom's like, oh, what do I do?
And sometimes those moms that are like happily breastfeeding have not packed a pump because they're like, I breastfeed. I don't need a pump. And then they're like, ah, yeah.
Yeah, that was it. But that particular mom had struggled with oversupply, just natural oversupply,
Yep.
and mastitis.
Yep.
And so she was kind of happy at that point to be
Yeah.
able to stop breastfeeding.
I think there also was a lip or tongue tie going on in
Yeah.
that dyad too.
Yeah.
So it was complex. It was a combo platter of problems.
Yes.
Yeah.
Quite. I mean, I think she chose like from every aspect.
Yes. Yes. A little bit of this, a little bit of that. Like Thanksgiving dinner. It's like,
Yes.
I want a little bit of sweet potato problem, some green beans.
Yeah. So she
Yeah.
was one who had to wean abruptly.
Yes. Yes. I actually do remember giving her tech support while she was still at Universal Studios in Orlando. Yeah. So, aggressive weaning is not fun. Forced weaning, like not by mom's choice, there's a lot of emotional responses that happen. And unfortunately, usually if the baby goes on a nursing strike, the most important thing for the mom to do is to release expectations and relax and not force, because forcing just makes babies go, nope, even harder and even more. And then that mom is showing up trying to force the baby to latch and feeling rejected when her forcing is backfiring. And it's an emotional roller coaster for those moms. And my job because I get calls for these, and sometimes it's like, oh, go get the lip and tongue tie clipped. And then they do, and then the problem is solved. That's happened a few times. Most of the time, it's me being like, okay, we need to get to a point of acceptance and offering the breast without pushing it. Can we do that? No, we can't. Okay, maybe we just accept this as this is the fate, and we either pump and bottle feed or we wean. And kind of helping them come to terms with that whole process, which is very emotional. And moms will repeat it, like lots of follow-up with those situations where I'm like, okay, this is what's happening. What are we doing? And she's like, yeah, but I tried. And I was like, let me see you try. And she's like shoving the breast in the baby's face aggressively. I'm like, no, 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 no. I said, happy times at the chest. Like, just relax and let the baby be exposed to your breasts being out, with no pressure, and let them, hug them with your bare breasts and see what happens then. And, and some different moms have different issues with like, they can't relax and not force it because they want it so badly. And they're so devastated that it's not happening. Especially when they've had a successful breastfeeder for 6 to 9 months. It's usually not young babies, like under 4 months, that go on nursing strikes.
Mhm.
It's almost always older babies, and there's always, and sometimes, honestly, sometimes I see a situation, I'm like, I have no clue why this is happening. I don't think that mom did anything wrong, and it's just happening. But usually those moms, when they do, those moms are usually able to get back into a more zen approach of acceptance and, like, okay, let's just woo the baby back to the breast. And they are successful at it. And the baby does come back to breastfeeding. So I've seen both spectrums, but my goal and my thought process when I'm working with a nursing strike situation is like, get at peace that whatever happens will happen and it's going to be okay as fast as possible so that you don't push your baby further away from the thing that you're trying to get your baby to do.
Mm-hmm.
Yeah. Yeah. So nursing strikes are interesting.
Is there anything else you would want to cover as far as weaning goes?
Yes, I do. So there is gradual weaning, which was actually my own personal experience. I breastfed on cue for the first year. I breastfed 2 or 3 times a night for the first year. Oh, there's also nighttime weaning. We didn't touch upon that.
All right.
Yeah. And then for my body and my health and my mental health, doctors again were having misinformation about how to treat my thyroid. And I was told to be able to take this one thyroid medication that the doctor thought I needed to wean because it was going to be dangerous for the baby. And even with research and education and knowing that that doctor actually wasn't correct, I still felt like I wanted more freedom to be able to choose what I put into my body to benefit my health overall. So I knew that I wanted to wean by 2. And so the first year, I just kind of went with whatever, let Jax kind of take the lead, and she would just breastfeed as often as she wanted to. And there would be no, we breastfed all the time, and it worked, and we were in sync together most of the time. And I also had to return back to work, and I was pumping. And so the day that Jax turned 1, I was like, I'm not pumping anymore. I don't care how uncomfortable I am. I'm going to just power through this because I hated pumping so much. So I stopped pumping, and then around 14 months, Jax was still waking up 2 to 3 times a night to breastfeed, and I was the only one that could boob Jax to sleep, and I started having very negative feelings towards my baby, so we nighttime weaned. So nighttime weaning happened, and then I was down to 1 feed a day by the time Jax was 2 years old. I just gradually chipped away with it. Like every month past 14 months, it was like, okay, this month we're going down a feed. This one, another feed. Okay, we're only doing, and then I started also setting boundaries, which a part of weaning is a process, and weaning kind of starts the first time that you'd be like, nope, it's not a good time for me to breastfeed right now. Yeah, you want it. I don't want to. That's when weaning starts. Offering solids, weaning starting. Offering bottles, weaning starting. And it can be a very long, gradual process that's not painful. But I wish, on the topic of weaning, is making me think of boundaries with our children and just how important it is to have healthy boundaries around our bodies. And when we're breastfeeding, oftentimes babies will do a lot of things that you may or may not enjoy that they're doing.
Oh, like clamping on the nipple and then turning and looking?
Yes. My least favorite, older babies they'll be breastfeeding, and this skeeves me out. It does not skeeve out everybody. Okay. I've had friends that it does not bother them in the slightest that their child, not baby, child is doing this. And I'm like trying not to look at them, but also make eye contact while we're talking, is twiddling. So baby's on one side of the breast eating and reaches over and plays with the nipple on the other side. That is not for me. That is like no go. Like I never let Jax do it, not one time. When Jax would start to try around like 8-9 months, I would just hold. No, this is not happening. You will stop eating. It'll be fine. But this is my boundary. And so like having gradual boundaries, like one of my issues with Jax when I was gradually weaning was that I didn't feel comfortable nursing in public anymore because I have large breasts and large baby, large breasts. I joke, and I'm serious. Jax offered my breasts to a waitress one time. Like looked up at the waitress and said, "Want some?" And like was like, "Meh." And I was like, okay, never nurse on the aisle seat of a booth again. Maybe I'm no longer comfortable with Jax having, this is not working for me. This is not working for me anymore. And so after that, like it wasn't that exact moment, but gradually I was like, okay, we only have mums, which is what Jax called it, on the couch or in the car. And we'd be at a birthday party, and Jax would be having a great time, and Jax would come up to me, mums, mums. And I'm like, we're going to go to the car to have the mums. And once we get to the car, I might want to go home, and we might just be leaving the party so that you can have mums in the car. Do you want to have mums in the car? And Jax would be like, mums in the car. It's okay. So I just started creating lots of boundaries around my body and when I needed autonomy with Jax. And that's the gradual weaning process. And I think that there's an importance in knowing that and understanding that that is possible. And there was not a lot of tears. There was not a lot of drama. I think that the last day that I breastfed, I was on my period and my nipples were so tender and sore, and Jax latched, and I was like, oh, and we're done. That was it. That was it. And I looked at my husband and I was like, take your child. I'm going to go be busy and not sit down for very long so that Jax doesn't try to breastfeed. So I'm going to be a moving target. One of the tips from the Leche League is don't offer, don't refuse. And that is a great first step if you are ready for gradual weaning to begin. Is basically if your toddler falls, you don't try to mother by breast and bring baby to the breast and offer the breast. You deal with it in other ways. But if the baby asks or the toddler asks, you don't say no. So, and I did a little bit of that also. But I think that it's helpful to know that gradual weaning is possible without it being too traumatic. Some people, they think that the best thing to do is like go on a trip for 2 weeks and leave the baby or child with a grandparent or a family member and be like, yep, and they're done. Well, Jax had many a night stay with both of her grandparents and would come back and want to breastfeed. So I don't like that's not a the grandmas would be like, I don't understand why you're still breastfeeding. That Jax is fine and eating and drinking fine when you're not around for 3 days. And I'm like, because I'm not ready to stop yet. That's why. And Jax still wants to. Yeah. I joke that Jax would have taken me to college. If I hadn't stopped. Yeah. How do you think Jax would respond to hearing that now? Like, oh, Mom.
Oh, yeah. We will not let Jax listen to this.
not until Jax is way older. Yeah. But, that gradual weaning, and that gradual weaning can look different for different people. And it can be kind of mother and baby led. When I was taught about weaning in my first like breastfeeding trainings and stuff like that, it was like either or. And I really do feel like when you create boundaries around your body in breastfeeding and chest feeding, that gradually that leads to mutual weaning, which I think is a beautiful thing, which is kind of what I did. So, yeah. And I just really want to encourage families to make boundaries about things that they don't like. And if you don't care about it, but somebody else comments about it and it's not a problem to you, keep doing it. Just because somebody else doesn't like it, like that twiddling thing, like it's not, my breast was not being twiddled. I could look away, and I did. Yeah.
Anything else you want to add?
Make sure that you need to wean. And also it can look like something you could breastfeed once a day for a long time, especially after your milk supply is established. So you don't have, it's not, breastfeeding in general and feeding your baby is not all or nothing. And there's lots of ways it can look to hold on to the parts of it that you like.
Yeah. I know I personally did that nighttime, pre-bed feeding for each of the kids. Like that was the last thing to go.
Yeah. And it's when breastfeeding's working, it's really enjoyable and it's a sweet, wonderful moment with your kid. So you want to hold on to something for as long as you can, as long as it's working for both of you guys, the baby and the mom.
Yes.
And I'd argue the family. Because sometimes mom being dedicated trying to fix their breastfeeding journey affects other members of the family negatively.
All right. Well, thank you very much for all of your insight around weaning and breastfeeding strikes and all of your insight around lactation in general.
Thank you so much.
So if you have any questions at all around weaning, whether it be choosing to not breastfeed from the beginning or weaning at any point during your breastfeeding journey, please reach out to an internationally board certified lactation consultant, an IBCLC, to help you along with that process. Thanks again for joining us for the Postpartum Years podcast, and we shall see you next time. Bye.